Hello class. This is my video response to this week's discussion post. Due to my surgery, I'm still going to be in this sling for another week to 2 weeks, which makes typing pretty much impossible. So I figured making this video would be the best way for me to contribute to the class and get my points across and my thoughts across. So thank you for your understanding. I do appreciate it. This week we had a situation posited to us that if a statistical cure that would prolong disease until death was caused by something like heart disease as opposed to breast cancer, which is what we're looking at, would that how would that impact our ability to make a survival analysis? And in my opinion, my first thoughts were that it would make making a survival analysis and interpreting those results difficult, if not impossible, to interpret. Now, I would like to preface all of this by stating the truth that I had a very difficult time with this module this week. The concepts were pretty in depth, and I'm trying to wrap my head around it. So if I do say anything out of step, please let me know and correct me if I'm wrong on anything, because I really want to learn it. I just sometimes it's hard without somebody teaching you directly. So if you have any thoughts on what I say, please let me know. I would appreciate that. But what I was thinking is by having a death event to take place that is not due to the specific disease that we're investigating, we would end up having a considerable amount of censored data. And as we learned this week, censored data falls on a flat line when you're looking at a survivability curve. And therefore, if we had a ton of censored data due to subjects in the study surviving past surviving long enough to die from something not related to what we're looking at, then they'd be censored, but the probability of surviving line would stay on the same plane. It would just continue outward. If that was the case, then by the end of the study, we would have a ton of censored data points that would not accurately represent the 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 accurate probability of survival for the drug. So I would have to say that we couldn't get accurate or probably verifiable results with continual censored data. So it would make it almost impossible to determine the survivability rate if that were the case. The second part of this week's topic is it falls more on a philosophical type of thing. Um, I really had to think about this for a while, and I broke it down into pros and cons. And what I got for pros was we would have more time. These individuals would have more time to spend with their loved ones, which everyone would want to do that. I can understand that. It would also allow them more time to get their affairs in order. And last but not least, but probably most importantly, is life. From my experiences, I know they're limited to only things I've experienced, and I'm kind of biased because I've been alive for as long as I've been alive, and I've never been dead. So I would prefer to keep living. Now, I really had to think about it long and hard to develop a cons list, but honestly, you have to ask yourself, what's better? Is death better or chronic illness? And that really depends on how the chronic illness affects you on a day-to-day basis. If you were living in constant pain, I could see how somebody could go one way or the other. When I first got into research, I worked in a renal clinic and I worked with a lot of people on dialysis. And dialysis, it prolonged their life. It wasn't a cure, it just allowed them to live longer. And I know from firsthand account from a lot of the patients that I worked with, a lot of them said that this was no life. Living every other day on a machine, pumping blood into their body was not a life for them, and they had a miserable last couple of years before they inevitably died. So I can understand how they would go one way while another person maybe who wasn't on dialysis would go the opposite. Another thing that I thought was if you were living longer with this chronic disease, you would have to the individuals going through it would have to watch their loved ones watching them experience it, and that would be that would be very difficult, I would imagine. So there's another thing that one would have to think about. And another, reality would be more debt. Longer stays in the hospital, more medication would be just increasing debt exponentially. And that would eventually probably fall on the shoulders of somebody else once that person passed. And so that's another thing that they would need to think about. So from a patient's perspective, I can weigh the pros and cons and how I would react to it, but it's completely subjective and dependent on every individual's own experiences. So I can't say one way or the other what's better. I think in this situation, if they were given the opportunity to take a medication that would prolong the disease and prolong life, that all of the risks, all of the complications, all of the chronic pain or chronic implications that could go along with their increased survivability should be explained to them up front so that they can make an honest and rational decision based on what they think is best for their life. At least give them that straight up, right up front, and then let them make that decision. Because, like I said with the dialysis example, it's completely different based on the situation and the context in which it's being applied. So that is my response to this week's discussion. I appreciate everyone for taking the time to watch this video. If you have any thoughts, questions, any insights, or anything you can help me with, I would greatly appreciate that. Thank you, and I look forward to hearing from you.